Good evening, everyone, and welcome to the September 16th edition of Beyond the Data. As promised earlier this week, after Governor DeWine's lovely throwback press conference in very similar vein to what he has been regaling us with for the last, or the first, whatever it was, year and a quarter that he has stopped so graciously over the summer, but started right back up. It was like no time had passed on Tuesday. But honestly, I have watched all of these press conferences, and Tuesday's was one that just, it made my hair stand on end. There were a lot of things in there that were disturbing, to say the least. It involved the governor, of course, and he had, I believe, 5 or 6 people from the hospitals, different hospitals, the Children's Hospitals Association, specifically focusing on children's hospitals, because that's what we need to talk about now. We need to talk about scaring parents about what's happening with our children and the children's hospitals, and making everyone afraid, because that's what we do. But before we get into that, I would like to advertise the next couple of Beyond the Datas. One will be tomorrow, actually, at about noon. Hopefully I'll be on time for once, but it will be with Dr. LaFay, and she's been very busy lately. She's running for school board locally, and of course she's pretty busy because the hospitals are busy. Especially her practice, since she actually does try to work with people beyond the procedures. So tomorrow, Friday the 17th, around noon, I'll be doing a Beyond the Data with Dr. LaFay. And then on Sunday evening, instead of just Carrie and I, we're actually going to have attorney Warner Mendenhall, who has been working a lot on exemptions, and he's a pretty eclectic kind of attorney. He does a lot of things like public records requests and suing places like the Cleveland Clinic, and lots of false claims acts and things of that nature. And so I've been talking to him quite a bit of late, and Carrie has as well. And do we have approval for him as a lawyer there? Or at least as a person?
As a person, absolutely.
Definitely an interesting guy. So Sunday night, and hopefully that'll be around 8:30, and we'll get to talk to him about how to deal with how to start up those exemptions, and who knows where the conversation will go from there. Definitely won't be a boring conversation, that's for sure.
No. I if I would have met him on the street and I didn't know he was an attorney, I would have been like, oh, he's really neat. He's very genuine. He's a straight shooter. I like that. But that whole politician or attorney, I just struggle with those two things.
And he was both. He was a politician who was disgusted with the way politics worked, and so became a lawyer. Went to law school, became a lawyer, and so yeah, we'll do that on Sunday night. That will be with Carrie as well, at our normal time, maybe even a little earlier, because I'm not scrambling to put stuff together that night. All right, I think I've gotten all the announcements out of the way. So let's get back to that lovely press conference on Tuesday. And I am sorry I am not talking about today's press conference, because there was another one today from ODH and Dr. Vanderhoff in the works, but I am a singular person. I'm getting more and more volunteers, but the volunteers also need volunteers to volunteer to manage the volunteers. So I'm looking.
So I guess I missed that there was even one today at all.
There was one. Yes.
So this is busy time for us as we start to chop and get harvest beginning. Mm-hmm. So I really think I missed a whole bunch, but we're trying to feed Ohio too. So, it's just all about balance. And I think we all struggle. Well, I struggle with balance. I mean, I think I brushed my hair today. I don't know. So there we are. But I can't wait to see these clips, because I haven't.
Well, I haven't collected them all because I already knew that we wouldn't be making through it all because we never make it through all of them. And some of the commentary from Patty Manning from Cincinnati Children's were epic. This woman honestly scares me, and so I wanted to also take those particular clips, and we need to tear those apart at a different time, or maybe I make a post about them if I can find some more time. But what she talked about was beyond frightening.
Wait, what hospital?
Cincinnati Children's.
Okay.
Yes. So she's been a guest on this whole crazy thing before. But her comments on Tuesday were even more frightening than I'd heard her say before. But so we're just going to talk today about what is going on in our children's hospitals, because that is the entire concept of what they're doing to frighten us, right? They're saying, oh my goodness, our hospitals, our children's hospitals in particular, are totally overwhelmed right now. We need to panic. Everything is going crazy, so we need to mask all of our kids at all times in all schools, and we need everybody who can vaccinate to vaccinate. So you have this overarching storyline of our children's hospitals are being overwhelmed. Really scary stories you're going to hear about the terrible things happening at our hospitals, and just really frightening. And then they try to conflate it with COVID.
I want to make sure that I'm making Patty Manning, Cincinnati Children's, that is the autism research doctor.
She said developmental behavior. Yes.
Yeah.
And yes.
She specializes with autism.
Well, in this press conference, she talked about developmental behavior, and she was very categorically, masks are fabulous and do not harm our children in any way, shape, or form.
Talking about infectious disease, right?
No, she's just talking in general that masks are fabulous. They do not cause any harm.
Okay. I just want to make sure that I'm...
Mm-hmm. That's only beginning. Don't get us off track. We got to talk about her all on her own, because she's a special case. Let's just talk about our hospitals right now. What's going on in our hospitals? What they're saying and what's actually going on.
Okay.
So the first one I'd like to start with, they had the CEO or president of the Ohio Children's Hospital Association begin, which he was actually pretty good. I kind of liked him because he was honest. He listed out the 4 things that are affecting our children's hospitals right now. So here you go.
Thank you, Governor. Good afternoon to the media. As the governor mentioned, and as we've shared with you, children and their healthcare providers are facing a perfect storm. It's a combination of COVID, driven principally by the Delta variant, which is affecting kids in 2021 in a way that did not happen in 2020. Secondly, there is unseasonably high respiratory conditions that we've never seen in the summer. We're at what we've called peak winter busy with RSV, parainfluenza, rhinovirus. 3, our behavioral health census, which even pre-pandemic was at a crisis, has been on the rise and continuing to rise, both inpatient and outpatient. And the 4th component of this, which you'll hear more about, are key staffing challenges that our institutions, like many other parts of Ohio, are facing.
It's pretty honest there. I mean, except for the first one, he didn't really go, well, no, that's actually pretty accurate as well. The first thing that he mentioned was COVID. When you get a COVID patient or somebody who has been identified as a COVID patient, there's a whole cascade of extra procedures you need to go through for those individuals.
I didn't hear that on that clip.
What, the COVID part?
He just said that it was driving by the Delta, or there's 4 pieces, and COVID, our kids are seeing the Delta variant that they did not see last year.
Yes. Well, that's what I'm more saying is that he's saying it's COVID, which it's not untrue that COVID is affecting how our hospitals are functioning. Not COVID, but our reactions, the hospital's reactions.
Right. Presence. Say our mitigation. to those. I could see that, but okay.
Yep.
It was pretty, I didn't hear anything on there that isn't self-inflicted. So next.
Yes, that's what I'm saying here. The COVID one is self-inflicted for the most part because
they all are.
Yes. The second one, now I've lost my train of thought. What was the second one you gave up there?
It was COVID, and it was unseasonably, we are in our winter peak, which absolutely.
We are absolutely in this as high as our winter peak usually is. So this actually is a fun little graph coming here from a website called syndromictrends.com. It's run by I forget, one of the testing companies, and they look at the tests that come back that they run or people run and look at what respiratory viruses are popping positive on their tests. And as you can see, the yellow line is SARS-CoV-2. Then it went up in, of course, the winter time last year, and then it went way down in June, July, and then it did go up. Not as high as that winter peak. And interestingly enough, notice how it's kind of flattening out and going down. Now, this is national. So it's not just Ohio, it's also national. And then the other things that are interesting on this graph are this kind of more gray purple line, or I should say the purple line here. The one that goes up, that's para-influenza, which they mentioned. And that's basically gone away again. And this, I don't know, grayish purple line, I guess, that's RSV.
I feel like is that lavender? I don't know.
Maybe. Sorry. It's not, they're not well selected colors, quite frankly. But this is RSV. So RSV and COVID are basically coming and peaking at the same time. They're coming up to maybe about 12% or so of these tests being given. And then we also have the blue line, which is our dear friend, Rhinoviruses, also known as the common cold, which have, because we've expanded our definition of what is COVID, it has the same symptoms as COVID. So, and that's up to
RSV.
Yeah, and is RSV. So you're talking about these three different viruses that all kind of look the same, although I understand that RSV is kind of more, especially in children, a little bit more clinically obvious. But it's it isn't? Oh, so that's another thing that one of the doctors was not telling the exact truth about, but that was last week's grand press.
Yeah, so I'm going to play devil's advocate with it, but I'll wait till you're done. And plus, you have really good comments over there.
Oh, I don't see. I can't multitask.
Okay, right, I can't. That's why I'm like, well, I can't really multitask. Like chewing gum and walking, not good. But I can read and listen, and I probably get like 50% of each. But it's fine. 50 and 50 is 100. But Sharon had asked a question at the same time that I believe it was Lisa. Yes, they kind of, those two comments kind of go together. Sharon said, "Are the masks causing extra early respiratory issues?" Whereas Lisa said more RSV because they had kids masked and made them distance last year, so their immune systems would be weak. Together, those kind of complement each other. Again, immunity debt is very real. So we're used to being exposed to things a little bit at a time each day, or each time that we're outdoors or indoors with people, whatever. We're just always exposed to things. These kids have been masked, and adults, because literally had a 52-year-old diagnosed with RSV, and that like almost never happens to where it's severe enough to where they need to seek treatment. That's just not common. You normally see this in young children. We've all probably had RSV at some point, but if we had it as we were older, then it was just a really bad cold, probably. Whereas, the young ones that have some immunity debt or older, like in the nursing home setting, we would see it then. But I'm talking 52 years old RSV. That typically just doesn't happen. But we're seeing several
that in my area as well, that where adults are getting RSV severe enough that it gets noticed.
Right. And that, this is normally not the time of year. We started this like end of July, beginning of August, I think, when I started talking to you, and I'm like, hey, RSV is coming. Like, it should not be here right now. I don't know what's happening. This is just not normal. So both of those that commented, again, absolutely correct. And the term for that is typically, it's called immunity debt. But I'm definitely going to play, as soon as you get to a breaking point, I'm going to play devil's advocate with that chart.
Uh-oh. So the third issue, so I'll get through the issues that the Ohio Children's Hospital Association director, president, he said there. And the first one was COVID, which was really self-inflicted, because if you test positive but you are not sick with COVID, there are still procedures that surround you, which include staff and PPE and the whole works. And the second one was all of these other bizarre respiratory illnesses that are occurring out of place. And the third one is behavioral health. Now, why would there be behavioral health issues in children who just started going back to schools where just a month ago or even a few weeks ago they were saying no masks, it's normal, come back to school 5 days a week, it's going to be fantastic. And then overnight say, nope, everybody's got a mask, and these kids aren't stupid. They know that it's not going to go away. It's going to continue on, because that's exactly what happened last year.
Right. And there's no light. Right. There's no light at the end of the tunnel. All of these decisions are being made for them, and they literally have no voice in what's happening to them. And there's no security. There's no safety blanket. We're asking our children, or not my children because mine are grown, but that's whatever. In general, we're asking children to bear the weight and keep adults safe. That's what we are doing, and that's just unfair. I feel.
And we're taking the football. We
Right.
keep just saying, okay, you just need to do this.
Mm-hmm.
And then we just grab the football and then, no, we're not going to do that. We're just going to keep doing this and never letting you go. And so, of course, and even in adults, we're having behavioral issues. We just call it slightly different. But for kids, we're creating these. So that's number 3 of what is filling our hospitals, our children's hospitals in particular. And then the fourth one are the staffing issues. And what cracks me up about the staffing issues, I don't think I clipped some of these comments about the staffing issues, but one of the comments one of these people had about staffing issues is that the staffing issues are because some of their staff members are parents as well, and because some schools aren't masking, their kids are getting quarantined, and so they have to leave to take care of their quarantined kids because their schools weren't wearing masks. Yeah. No mention of lowered benefits, no mention of all the staff that left when they were essentially laid off during the summer when the elective surgeries disappeared, last summer when the elective surgeries disappeared. No mention of, I don't know, vaccine mandates coming down, nothing. No. It's because schools aren't masking their children, so their children are getting quarantined, and so they have to stay home with them.
Yeah, I don't understand the whole quarantine, like modified quarantine that they're doing at all. Like, I don't, I know one of the districts, they're like, if you're not symptomatic, come to school. Like, I don't care what's happening at home. If there are 4 kids in the home and 3 are symptomatic, they stay home. If you get a test, that's on you. If not, then, same thing. You only have X amount of days until you have to have a doctor's note to return. But if the one that doesn't have symptoms, if there's not a positive test and it did not happen in school, come to school. We don't care. Like, this is crazy, And then there's other ones that I've heard that are like, you need to quarantine your husband's brother's sister's children twice removed because you might have come in contact with somebody at lunch. And then we have a third one that's, again, pretty local, that was like the whole band was exposed. So they gave the kids 2 choices: quarantine for 14 days or get a test every day for 10 days. You pick. And then we have a college, on the flip side of that, that could not come to one of the he's a football player. He could not come to the family funeral because he was in quarantine. It's a suite, and two of the suite mates had tested positive. It's 100% vaccination rate on the campus. Two of his suite mates had tested positive. So he was also in quarantine. However, because he was vaccinated, the college gave him his own bus and his own hotel room so he could still play football, but he couldn't go on campus to go to class, and he couldn't come home for a funeral. Like, to me, the highest probability of transmission in that whole scenario is on the football field.
It's outside, but yeah, I suppose you could spit on your.
Do you realize how much body fluids is exchanged in football on the field?
This is a good point.
Yeah, so I just don't understand. Like, there's no consistency.
Well, that's part of the issue. That's one of the things that will bother any human being, and that's one of the big reasons for the behavioral health issues in the number of children who are at hospitals because of those behavioral health issues. Now, this one, just as you're talking there, this it made me think of this. So this was posted yesterday, I believe, or maybe the day before. Oh, it was posted 2 days. It was 2 days ago because it was on September 14th. It was the day it came up on my feed. Probably it was the kid had it happen, took a picture, put it on Facebook. It got picked up by somebody I follow and popped up on my feed. And I mean, this is incredible. This is at a private school, Lake Catholic High School. So this is up along the lake east of Cleveland. And this guy, it looks like he's a 12th grader. He got a detention for being in the cafeteria, walking to get a napkin to wipe a runny nose! !
So just let that nose run in the mask and keep it moving. And then we wonder why we have, hands, foot, and mouth, and a whole football team has to quarantine and they can't play ball, because of hands, foot, or no, they didn't have to quarantine. I'm sorry. But they had to cancel their game because of hands, foot, and mouth. And they're like, and then you have this poor kid. He's just trying to freaking blow his nose.
Well, and I read this and I'm also sitting here going like, I read it again and I'm thinking, did he have a mask on while he walked across the room? Was it because he had the mask off because he was eating and then went to go get a napkin? Or did he actually put the mask back on? Because it doesn't actually, clarify. Was he walking around without a mask? Was that the problem? Or was the problem that he dared want to use a napkin, which he would directly throw into the trash, which no one else would touch? But
his mom did have the commentary up on that. She's like, very first detention ever, and he's a senior. He's never had one before, and he had his mask below his nose to go get a tissue or a napkin or whatever to blow. He had sneezed or whatever, and that was the way that the commentary read from mom. And she, of course, she was mad. I would be livid if this was my kid. Plus that's a private school. There's a lot of money being paid for tuition. There's just a whole array of things, but this poor kid, like, and as an adult, when you read back what you just wrote, like, at what point you're like, wow, this is really bad. Like, this sounds really silly that I'm writing this detention out for. He wasn't, you know what I mean? At what point do you use
sanitary?
That? Right.
I mean, it's the crazy part. He was being sanitary, and he gets a detention for being sanitary. Now, since we've drifted off into quarantine issues, I might as well bring up a clip here of I think she's from Dayton Children's, and no, that doesn't make any sense. Or maybe she did. Yeah, I think she is from Dayton Children's, and she brought up an Akron study of how fabulous masks work in preventing disruption due to quarantine. And listen very carefully to what she has to say of how this worked.
We know this works. We know last year when our kids were in school and masked, we did not see this demand. We also know that masks do not harm children. They do not create illness in children, and that they are what will work. And I'll just share with you, our colleagues up in Akron Children's were able to review 1,070 kids from the Summit schools who were required to quarantine in since August 16th. Only 23 of them were from schools that there was no mask requirement. So of the 1,070 children that were required to quarantine, only 23 of them were in schools with no mask requirement. After Akron Children's was able to share that really stunning data, many of the schools in Summit County pivoted to requiring masks, and the quarantine numbers of kids in quarantine dropped 72% prior to the week before. So we know this can work. We know we owe it to our kids to make this happen.
Sounds fantastic. I mean, you went from 1,070 and dropped 72%, and out of the 1,070, only 23 were from schools with masking rules. Well, yeah, because your quarantining rules are dumb. I mean,
they're not science-based.
It's insane. Yes, because they say that if you have a mask, then nobody has to quarantine. If everybody's forced to wear a mask, then nobody has to quarantine. And nowhere in there does she talk about how many of those 1,070 kids ever got sick.
And that's exactly my issue with the quarantine, is there are no longitude, like nobody's following these kids. I think Lori had said that too. And so I'm like, yes, for somebody that's legal and not science-based, they get it. Like, parents get it. And no, these kids aren't being followed to see who actually gets sick while in quarantine. That's just not happening. It's not being done. So we have no idea how effective, if at all, it is. Who's showing symptoms? And I'm going to tell you from personal experience, from what we're seeing, and of course we're not congested like other districts are, is there's not many, if any. Lynn, which I know Lynn is, she does behavioral and developmental therapy, and I don't know the whole big title. It's a very long title. She said that the children I've been encountering are practically feral after having been kept home for 18 months. For some, it's half their life and the formative years. So sad. And I think that's just really impactful. Because they're getting overstimulated, if babies were born at the beginning of this pandemic. So they're, 18 months in, or almost 2 now, really. They're closer to 2 than 1. And they're not used to seeing a full face, and that overstimulates them, or being around people and sounds. That's just something I just don't think we thought about.
Well, yeah, I think a lot of people thought about that, because it is. I actually remember the very first public talk I gave was out in Erie County, I believe, with Dr. LaFay again. And I do remember somebody there had a very young baby with them. And there was definitely commentary about that. I mean, that baby was just staring at everyone there, just like amazed, like all these faces, because that baby had been born when lockdown had occurred. So probably hadn't seen too many faces outside of its immediate family. And it was just like, kind of.
Okay, so I guess when I say we didn't think my immediate circle, because we just don't do that. Our kids, mine are older, but we have a lot of kids that were around, and tomorrow is not promised, and that doesn't mean I'm out here, skydiving with a parachute that may or may not work or whatever. But I want everyone to know that, how I feel about them, because I don't know what will happen tomorrow. And we can't just keep putting things off. That's our personal feeling. That doesn't mean it's right or wrong. So ours, we've continued to, have people around. Once we got off of that first initial quarantine that was hellacious, we said, we're done. we won't do this again.
Just one of those, side effects. Nothing to be worried about for anyone. I think, we should maybe move back towards what the hospitals are experiencing again. So we had the groundwork for what the CEO of the Ohio Children's Hospital Association said. Again, what were our issues? All self-inflicted. COVID, but a lot of that is wrapped up in the procedures necessary to take care of COVID or properly contain it in their way. The second one was actual illness, but normal respiratory virus illnesses that are spiking in a completely unexpected and abnormal way and completely unseasonal. And the third one was behavioral health is filling up the hospitals. And the fourth one is self-inflicted staffing issues that they're trying to blame on something else besides mistreatment of the staff. But so the next, one of the next people, the woman from the CEO and president of Dayton Children's, she says the same thing. So let's hear what she says her hospital's being filled with right now.
Are seeing very high levels of respiratory diseases such as RSV, which impacts our small babies particularly. We're seeing a surge again in behavioral health. Unfortunately, as our children go back to school, behavioral health issues really rise again. All of this happened coincident with the opening of school unmasked. It correlates directly in the timing of schools reopening.
See, this is what they did the entire press conference. I mean, I'm only picking out a couple of these, but I cannot tell you how many times they did this in this press conference on Tuesday. So right there, what did she tell us? She told us our hospitals are filled with RSV. Number two, she told us that our kids are having lots of behavioral issues, bad enough to be hospitalized. Then she says they correlated with the beginning of school. True, because that's kind of normal when kids start getting together. Things like RSV get transferred. That happens not uncommonly. I mean, usually RSV doesn't, spike then, but other respiratory illnesses do. And, rhinoviruses or any other kind of thing. When you get kids together, they start to share all those things that they've been keeping to themselves. But, and then she turns around and says it's because the schools opened without masks. What does that have? I mean, yeah.
Well, what is that they're always saying? Correlation doesn't equal causation.
Yes, correlation does not equal causation, but actually in this case it might, because what happened? You had all these schools who said everything's going to be normal this year. We're going to be normal. We're going to stand firm. We care about your education and mental health, kids. Oh, wait, no, everybody's masking. Nothing's changing. Everything is back to the way it was last year. Well, yeah, that's going to cause
right. So what I'm saying is, it wasn't the fact that they're unmasked. It was the fact that they, it's like, if you do this, I'll take you to get a milkshake, and then you dangle it like a carrot, or you let them have a couple days or whatever, and then you pull it back. We're going to see kids act out. As an adult, I would be acting out too.
Oh yeah.
This is unreal. I just don't understand. We have the dumbest smart people on pressers that I've ever seen in my life.
But this was a theme throughout each one of the cavalcade of experts that they had on. It was incredible, because they would say things like the Ohio Hospital Association, Children's Hospital Association guy. What he said was true. Those things are happening. They're all self-inflicted, but at the end of his spiel, he said we all need to be masked. All the schools need to be masked, and everybody should be vaccinated. It was pre-programmed in. You could say whatever you wanted about anything else, and no, we need more masks and everybody vaccinated. Even have nothing to do with what you just said. In fact, I'll play this one. This one is from a woman who's at a children's hospital up in Lucas County, which is Toledo. And I forget what she is. She's something with nursing, but she told the story of how bad it is up in Toledo. Now listen to their numbers.
In the Northwest Ohio area, in the city of Toledo, At Ebi Children's Hospital, we have seen a significant increase in our inpatient and outpatient volumes for kids who have been sick, including kids with COVID. To share some perspective, our volumes inside the Children's Hospital have been over 100. Our average daily census has sat over 100 since the second week of July. That is unprecedented for us. Usually, volumes in the Children's Hospitals drop in the summertime months. We have seen a significant increase in the number of patients admitted with things like respiratory illnesses, RSV, parainfluenza. Again, those are wintertime processes that we see in our kiddos, usually sometime after November. Throughout the winter months, we have seen that consistently since July. We're running an average daily census of roughly 3 or so children now who are COVID positive.
Did you catch it? We started that long commentary with we are overrun. It's unprecedented numbers. We are looking at daily censuses of over 100 beds in use at our children's hospital. We're seeing RSV and parainfluenza, and we're overwhelmed. She says in another clip, or I don't have the clip, but in another part of this press conference, she talks about, their intakes are just overwhelmed. They're seeing parents of children sit in the waiting room, waiting to get in, and then giving up and leaving. So they're just bursting at the seams. Again, over 100 in census. And at the very last little bit, did you catch what she said at the end?
No, because I wanted to punch her in the face. So what was it?
3 average COVID positive census per day.
So, all right.
And again, census for people who don't understand the terminology here. Okay, so you have admissions. Admissions involve individuals. So if you say I have 3 admissions, there are 3 people, separate people going into the hospital. And if you say we have 3 average admissions per day, we're saying day 1 is 3 people. Next day is another 3 people. So that's 6 people. Next day is another 3 people. That's 9 people. What she was talking about was census. Census is the direct count of their hospital beds. So she was saying we have over 100 at this time of year, which is an unprecedented number of beds filled in a children's hospital. And 3 of those over 100 beds were with COVID. And those 3 on average could be the same 3 kids each day.
Sure, they could. There's no reason why they couldn't.
Mm-hmm. So
or it could be that they
100 kids, 100 beds occupied, 3 with COVID.
Yeah, but she was so general that it could have. I mean, honestly, you can look at it anyway. It could have also been, she said census. She didn't say ER census, inpatient census. It was maybe they could have been come to the ER and treated for COVID.
She would have been on this kind of call. Yeah, I'm pretty sure it was would have been emphasized. I don't know what the size of this EBIT or whatever it is, a children's hospital is, but the way she was phrasing it, it sounded like it was the whole hospital inpatient census there.
Okay, so if it's the whole hospital, did that include the ER?
I don't know.
Because, you have specific beds dedicated to pediatrics and the ER too. I mean, that's just the way it is. So for children's hospital, hospital does.
The point of it is here, this is her own words. You can see how far she spaced those things apart.
Right.
100 census and 3 of COVID.
Right. So
the problem COVID is if we're concerned about COVID spreading to our children, if we prevent them from getting COVID, is that going to make a dent in our hospital filling problem?
No, I mean, no. I personally don't feel that it will.
Well, it won't. I mean, we could say there's 100 that are beds that are in use in a single day, and there are 3 COVID. You remove those 3 COVID, is it going to make it any better? No.
That's one less staff that you need. I mean, because, well, typically peds ratio is 3 to 1, so that would be one less staff that you would need.
So that's the only difference it would make, is one out of whatever, 34 or something like that, for 34 plus. It's not impactful. And she said it. I didn't cut it. I didn't manipulate the distance between those 2 sentences. That's how far apart she said it. And of course, completes the whole story again with, so we need everybody to mask, and if you can vaccinate.
Yeah. So
respiratory illnesses that are not COVID.
Yeah, I mean, I didn't catch it, and I was specifically, listening for it, and I still didn't. So I can imagine those at home, they have kids, especially, if they're not looking at what we're looking at, or like, oh my gosh, I can't take my kid to the hospital. I mean, that's just a typical response as a parent.
It's true, though. That's the thing. That's what's so frightening about this whole situation. You can't take your kids to the hospital because they're full. They're genuinely full. I mean, I have a longer clip here about the situation. It's exactly this kind of psychological manipulation that they're doing. They're amplifying the fear because something bad is happening right now. There really is something bad. Things are.
Oh yeah, we're in trouble.
Yes, we are in trouble. But what they do every single time is they tell us and scare us with the danger, like she just did there. Over 100 census. This is unprecedented. We've never seen this before at this time of year. Making us feel scared, and then they'll just kind of like slide it in. You didn't even hear it. You didn't even catch it.
I didn't, and I was listening for
100 census, and we're doing about 3 COVID. So wear your mask to stop the spread of COVID. Everybody and get your vaccine for COVID. All you focus on is that first scary story, and then you just kind of gloss over the fact that COVID's not causing this. Something else is. And so why are we focused on COVID? Why are we making people out there? Because they aren't listening that closely. They haven't. I've listened to that clip like 4 or 5 times, and people nicely, transcribe some of this, so it's easier for me to find the clips and to cut things out, and it just saved me a ton of time. So I've seen this again and again and again, and so I heard it. But if you're just listening, you're afraid. I mean, the stories that they told were scary. So here's my last clip that I've loaded up for today. Then I'll go to some graphs, which should be fun too. This is a little bit longer, but I mean, again, what I just told you, or what the one that I just showed you, came before this segment. I believe just right before this longer segment about what is going on that truly should scare people. Truly, in the Toledo area.
But I will share, we had a very significant and very frightening event occur for us last night in Lucas County. At 10:36 p.m. last night, all of our Lucas County emergency departments went on EMS bypass. That includes eBay Children's and all of our adult hospitals. What does that mean? That means that if a rescue squad was called for a 911 call and needed to pick up a patient and deliver them to a hospital, if that hospital is on bypass, that rescue squad is not allowed to stop at that hospital. Every hospital in Lucas County was on EMS bypass simultaneously last night. It's the first time it's ever occurred in any of our recollection of the last 30 or so years, unprecedented for that to occur. What happens at that point in time is our Toledo Fire and Rescue, our Lucas County EMS system, goes on what's called code red alert. And as every EMS call comes in, they are dispatched one at a time throughout the community to our individual emergency departments. What does that mean to our folks? That means that you don't necessarily go to the emergency department that's closest to your home or most likely suited to take care of your direct patient needs. It might mean that a 3-year-old who's in need of an emergency department that's specifically for pediatrics is delivered to a traditional ED because that's who's next in the queue. This is an unprecedented event for us, and one that's, as I said, a bit frightening for us, more than a bit frightening for us as well, because it speaks to the volume of sick people that are being managed in our systems as a whole. Certainly that impact included our Ebi Children's Hospital Emergency Department as well. That situation lasted for us in Lucas County for over 8 hours before we were able to alleviate some of the volume issues in 4 of the local hospitals, including our very own, to come off of bypass. Again, unprecedented for us to have ever been in that event, and definitely something that's very concerning for us as we strive to care for the youngest and the most precious of our resources.
So this is the data from the inpatient and ICU bed capacity. Yes, of course, she talked about they were emergency department visits. That's what they were on bypass. But if we look at this data, and this is for all of Region 1, but obviously Toledo is the only major city up in that corner of the state. They've got room in the hospital, and it's not COVID, which fits perfectly with what she just said there. Their Ebi Children's Hospital is bursting at the seams, but only a couple are COVID, which should make everyone ask, what is going on? She didn't say anything about what they were there for.
Yeah, I'm going to say, and that's I always refer back, like the state is fantastic for their wonderful data. Gosh, they've just come so far in 22 months. Wow, it's great. But if you ever want a really good, solid picture, the best, I don't want to say that the best place, but a good place to look that really breaks it down, and I say that a lot, is the HHS website, because you can look at every single facility, and you can really break it down and narrow things down. So I do like that one.
This is not that one, is it? This is a different one.
Yeah, I don't know what the heck that is, but
this one is really cool. Somebody texted this one, the link to this one to me not long ago, just like a couple days ago. Oh my goodness, this thing is the coolest thing ever. It's the Statesman Journal.com, and I need to set this link up on the page in the links here.
Do not let that one though. See, I guess where I'm going with it was, the whole devil's advocate thing is because we can tell by looking at that on HHS because it's billing. So if it's not being billed, if it's not being coded, then it's not being billed. If it's not coded as such, then it's not going to be reimbursed as such. So no matter where it's coming from, it's going to be bottlenecked into the HHS system because that's how things get paid. So when looking at that, and it has a very, very short lag time, whereas I think we stop at 2 o'clock, maybe, is that right, on the state website? Okay, they stop at 8 p.m. So there's you're less than 24 hours lag time. But in looking at that, you can tell things like, is this facility, you can look at staffing, but is this facility, do they have 7 days worth of PPE? Do they have 3 days worth of PPE? Do they have, and this is a big one, and that's why when she said that, I was waiting for her to say it, hoping that she would really be transparent, and she didn't. The other category that's there is there enough blood and blood byproducts in this facility for 7 days? Is there enough for 3 days? Is there or is this, due to the blood and blood byproducts, is this facility at risk to have to go on diversion or bypass, which are two separate things? And she said they were on bypass. She did not say they were being diverted. However, I know that statewide, our blood byproducts is getting better, but it's not good right now. We do not have a good blood supply in the state.
So basically what you're saying here is that what she was saying could mean a ton of different things.
Right. So if she was on, if that facility is on bypass, and I know that our whole state struggled over the weekend and beginning of the week with, like, there was no fresh frozen plasma at one location in the state. We didn't have any platelets in a different one, and so because of that, they had to bypass. If it was a trauma that potentially needed blood, they would have to bypass to the next facility that could type and cross match them that also had blood. So I like that because
she was talking about 8 hours. So it sounded more like it sounded like it was more of a situation of, 4 different hospitals and everyone was getting bypassed. I would imagine that's more than just blood, because then they should take in non-trauma patients, I would assume.
But she didn't say that they weren't.
She didn't. It's just true. She didn't say that. I hate it when you tell me the ways that we are.
Yeah.
But
Right.
This particular website is very, very interesting. They clearly were, if you look at it all a little further back and stuff, they clearly were definitely in the scaremongering thing corner. It looks, when I looked at it, it looks like something that was set up relatively early on and just started keeping this stuff together. And this is daily census stuff. So these are beds. And you can see, this is just Ohio, and it looks like you can do it all throughout the country, and choosing up here different state, and you can specify counties in the state as well. And what's interesting, and you can look at individual hospitals within each county as well. But for instance, Ashland County is full. All of their 28 inpatient beds that they have in Ashland County, and all 8 of their ICU beds are genuine.
When is that from?
It's over a week, I believe. It's I think the last one is September 3rd to September 8th. I know I was looking at
today, right now, Ashland, which is a UH facility, it's Samaritan. They are not full.
Yep. I do know that on here they said so surrounding area hospitals. So week of September 3rd. So these are week of September 3rd. All of these are week of September 3rd.
Okay.
It's 3rd through the 9th that this is showing. But you can see, this is Cuyahoga County. Some of the hospitals are, they're not empty. And others are. This one's ICU. UH St. John has its ICU pretty well full.
Well, it did as of what, the 9th or 3rd or whatever that week?
Yes, as of the week of the 3rd to the 9th. So we should be clicking over to the next as well. But you can see how it varies around. The one, of course, that always makes me laugh is our dear friend, Holmes County. The one that's not even 15% fully vaccinated. Well, would you look at that? You don't have any ICU beds at all, so I'm assuming they would get anybody.
Well, they never have.
They would go someplace else, but even then, we're not even dealing with low levels of severity here, and they're just empty. They're all over empty. Why would they be empty? But places, I don't think I actually looked at Delaware. Oh yeah, Delaware is hurting. Although a lot of the Delaware would end up in Franklin County as well. But I would say, as a layperson, I'm looking at that ICU and I'm going, well, that looks high, but again, it's only 5.6 out of 6 beds. So I suppose you'd have to look at Franklin for where those Delaware County residents are going. But this is not empty. While our most naughty county is quite empty.
Right. Yeah. But then again, like I said, you're not gonna have an ICU bed. You can't make an ICU bed.
No,
if the facility doesn't have it, it doesn't have it. So is that your last graph?
No, I don't have any graphs of mine up yet.
Oh, okay. Sorry.
Well, so what do you want to interrupt with?
I'm not going to interrupt you. You just keep going and I'll provide commentary. But I'm definitely, I hope, I mean, it's 11 o'clock, so I don't know if I'll get to, but I want to play devil's advocate with this whole thing, because I think there's just some confusion, which goes back to what is a case.
Don't worry. I think we're thinking exactly along the same lines here.
Okay, chop, let's go.
Oh yeah, I think our brains are in sync. I just need to get back to, let's go here to finish that whole thing up again. This is actually from September 3rd. I had this, it's from Fox 8 News up here. And if you read what it says, even then, all you need to do is read and think. Spokesperson for university hospitals reports it has adequate capacity to care for the needs of battling COVID or other illnesses. And we have adequate staffing, of course. And what's the title? Sorry, I missed that. COVID surge pushes some ICUs to capacity. And it's like, oh yeah, well, we've got enough resources. And then down at the bottom, of course, both university hospitals, Rainbow Babies and Children's Hospital, along with Cleveland Clinic's Children's, report no increase in pediatric patients being admitted with COVID-19. So big scary headline of, we're all, the kids are under a lot of stress and bad things are happening. And it comes out that, well, actually, none of those up here in Cleveland area are seeing any increase at all in hospitalizations for children. Then comes to more graphs. So people who have been following me for a while know about Paul and his magical graphs, and he made some new magical graphs for me in the whole system again, which makes me very, very happy, and at the same time completely overwhelmed with information that I'm trying to process. So today what I wanted to show is, I mean, we're kind of late in it, but I'll post this one with a genuine post as well, though, and really work through the new ways I can look at the data and tell you what's going on. So what this graph is, for those who haven't been following me for a year or so, this is a graph that shows onset date versus hospitalization date, admission date. So onset can mean one of two things in the Ohio CSV file. Onset could mean either the day that symptoms started, or if there are no symptoms, it can mean when you tested positive. Now, is somebody who's not ill, not actually with any symptoms, actually ill? In normal person land pre-COVID, no. This is something that I used to do quite a lot early on, and I could do this with deaths as well until they disconnected this data. But if you look at the data that is in the CSV file that the state of Ohio provides to us, and you compare the dates of onsets and the dates of admission to the hospital, you can make some inferences about whether or not the person involved actually is ill with COVID, or if they are ill from COVID versus testing positive. Now, I kind of break it down into several different groups. The first group here is this one here, which is the green group. These are expected hospitalizations. These are where onset date precedes admission to the hospital, between 1 day before admission to the hospital to 30 days. So that's kind of a pretty wide window that makes sense if you get a respiratory illness. If you get a respiratory illness, if you start coughing or sneezing or having anything like that, do you go to the hospital that day? Not likely. Usually what will happen is you'll get it, you'll start getting sick, you'll start getting sicker, you start getting worried, and then you go to the hospital. Now, again, these are just 0 to 19-year-olds. Now, there are a little bit of funkiness with particularly elderly people, because the nursing homes would occasionally send those nursing home residents straight to the hospital. So, but that's the green group are ones that had onset of, the green group is actually way here. That group is the only part that really makes sense. And since these are kids aren't likely to run to the hospital within a day or two of getting sick. I mean, maybe some who are already compromised in some other way, they might. But for the most part, these two little lines here, I don't know if you can see it, but they're cuddled up to this big yellow line. Those are
they're tiny.
They are tiny. Maybe actually, I can zoom in. I have the power.
Okay, perfect. That's much better.
Yeah, so this little tiny group here, this green, and much better. Thank you for reminding me I have the power. This little group of green, hospitalizations. Now, again, everything on this graph, hospitalizations, because that's what we're scared of right now. This whole press conference was all about the hospitalizations and scary and kids and that kind of stuff. So here we are, 0 to 19-year-olds. How many are actually in the hospital potentially for COVID? Because this little group fits. But these two little spikes here are kind of questionable. When we're talking to 0 to 19-year-olds, they are unlikely to get so ill from a respiratory virus within 1 to 2 days that I would also question the validity of those two peaks as well. Those might be situations where you have to go in for a more urgent surgery or something of that nature and need to be tested for COVID ahead of time. But it still needs to get done because you're a kid.
Okay.
Yes?
No, I said, okay, like I agree. I get it.
Yeah. Okay, you understand the logic of it. So if you do that, take away those 47 that occurred on the days 1 to 2 days before admission, which I believe it makes most sense. Those two groups are those 2 days don't make sense as a respiratory virus becoming more severe and sending you to the hospital. That group, this is our good group. Next group, whoops, I don't want to go back. Get back there. The next group is this very large one here, this yellow bar. These are onsets on the date of admission. When you get a respiratory virus, you don't go to the hospital that day. You don't go and end up in the hospital.
I don't know, Kathryn. I've seen some parents do some crazy things here lately, but
this is true. But the hospital is not going to admit you when you cough.
No, but they could be there for, I feel like, onset, date of positive, or date that symptoms began. Which one are we using?
That's the thing. So here, follow my logic here. So what we're looking at here is either one. It could be either date of symptom onset or date of positive test. Okay. Now, 0 to 19-year-olds are not likely to end up going to the hospital and being admitted on the date of symptom onset and be admitted to the hospital for the symptom, for the disease that is causing the symptom. These are kids who are going to the hospital and testing positive when they arrive.
So 0 to 19, like, is that as far as it breaks up?
Oh, no, I can do every age.
Okay.
I have. Wait, were you following me all this time, Carrie? Did you not look at my graphs?
Well, no, I didn't know for this particular one.
Mm-hmm. But they're still the same groups. But so the yellow bar ones, when you have onset on date of admission, that is telling you, any way you slice it, that these kids were not being admitted to the hospital because of illness from COVID.
So,
or they're sloppy, or whoever's doing the intake is extremely sloppy, which is also unacceptable.
So I wake up at 2:30 in the morning, and my four-week-old is showing signs of respiratory distress.
Mm-hmm.
And I go rushing into the hospital.
Mm-hmm.
And they admit that child at 4:30.
Mm-hmm.
Does it look like COVID? Does it check the boxes of clinical COVID?
But it's not COVID. That's the point here.
But by Ohio, it is.
Yes, but I'm not talking about Ohio standards. I'm talking about reality standards.
Okay, but so we're seeing this increase in RSV. A positive RSV does not rule out clinical COVID.
You're arguing against me when we're not actually at loggerheads here. So I'm trying to say this is coming from the state of Ohio. They are calling all of these hospitalizations, which is 338 hospitalizations for 0 to 19-year-olds in the space between August 1st and September 15th, which is where they're saying it's the Delta variant, be scared. This is when our hospitals are all filling up and everything's going nuts. So this is what Ohio is calling all of these things equally.
Well, yeah, it fits.
It equally, every single one of these is considered a COVID hospitalization. But if you look at them individually and say, does this make sense as this hospitalization occurring from an illness with a respiratory virus, and specifically COVID-19, does it make any sense? So we're not arguing here.
No, I think I'm saying that just in general, you know, only because I've seen so many comments that not necessarily right in our comments right now, but just in general that are like, oh, you know, RSV is high. How can you call it COVID? And that's how in Ohio you can clinic it, because the clinical presentation is the same.
Well, I'm not even going there. I'm just going in terms of just
right. So
don't complicate things, Carrie. Don't complicate it.
I'm saying, so it's not wrong. It might ethically be misleading, but it's not wrong.
No, it is wrong, because we're talking about reality and not whatever you little medical people like to do. Okay, so no more, you know, fake-o, you know, stuff. I'm talking straight, you know, logic, simple logic. Control yourself. This is far too late at night for you. Let's focus here, okay? So what we have here, it's late. So what we have here is the green group is a reasonable admission to the hospital for a respiratory virus that becomes more severe with time. The yellow bar are children who had onset on date of admission. Now, no one, and specifically because little babies, to my knowledge, nobody's ever said that little babies become severely ill with COVID at all. I don't know, have there been any infants that have been, you know, supposedly died from COVID and then were shown to really do it? I don't, without other significantly severe illnesses, no. Babies just aren't affected. They are, however, very affected by RSV.
Very.
But again,
scary
we're talking about COVID here. So the odds of that happening with COVID are basically nothing. So those on the date of onset are not, in almost all certainty, due to COVID, because it's not enough of a time frame to do it. Then we have another group here that has onset of symptoms after admission to the hospital. Therefore, they could not have been admitted to the hospital for COVID. They had to have been admitted to the hospital for another reason that was not COVID. So that group of hospitalizations is not valid either.
So what's that called?
What do you mean?
If they contract the infection in the hospital setting, what is that called?
It's not even certain that it's nosocomial. I mean, we're not talking about that. There's no reason why you should think that must be nosocomial. That could be just simply they had it before they came, and oh yeah, we needed to test you for COVID anyway because you've been admitted to the hospital. Oh, this is the date of your positive test. Or say infants or something like that. And you were born
like Erica.
Yeah. Well, not really. But then you have a group way out here, which are hospitalizations that occurred way too early, over 30 days between onset and admission. That does not make sense as an admission, a hospital admission for COVID-19 disease. That doesn't make any sense. This one out here is what, like 250 days before being admitted to the hospital, they had onset. No.
So that one would be more like Erica.
That would be like, oh yeah, I like this one here. But yes, those ones happen pretty frequently too.
Okay. And I can see how that happens. I don't agree with that. I think that is just a data oops, but they've had a long enough time to correct that where it does not attach to that.
It's worse than it ever was.
Of course.
The total data, it's worse than it ever was. So Yeah, I don't know. Just let's try to focus here, okay, Carrie? Let's try to finish this one up here without too much getting off track here. And then the final group here are my favorite. These are admissions to the hospital with COVID-19 with an unknown date of hospital admission.
Can you say that one more time? Admission to the hospital.
Mm-hmm. They are
COVID-19.
For COVID-19 with
but COVID. They don't know when they got there.
They don't know when they were admitted. Now that's a key point, I think. It's an unknown date of hospital admission. And we're talking about the number of these unknown dates of hospital admission. I believe in total we have 60,000 or so at this point, hospital admissions that are unknown. I mean, sorry, 60,000 total hospital admissions with COVID. And I believe we're approaching 8,000 of those are unknown date of hospital admission. Over the last couple of days, we've been picking up about 30 to 40 every day. When they put up, we've got 220 hospital admissions newly reported. For at least the last few days, 30 to 40 of those are unknown date of hospital admission. I don't know when they supposedly occurred.
That's
unknown.
That's embarrassing.
So it is very embarrassing, but it's also very interesting. So what we're looking at here is when we have in total 338 hospital admissions with COVID-19 in the 0 to 19-year-old crowd. 114 had an unknown date of hospital admission. 96 had, and this is unknown, is unacceptable, simply because somebody knows. If that child was admitted to the hospital, somebody knows when. Specifically, the people playing with the money. There's no reason for that, especially after all this time. 96 had onset on date of admission. Also, that is not an admission for COVID-19 disease. You had 16 with onset of admission after date of admission. Again, they could not have been admitted for COVID-19. Just could not have, because they'd already been admitted.
Maybe the facility didn't have the reagent.
Don't even start. If that's the case, the symptoms would take over. When did you start coughing? 3 days before you came in. Even if you're tested 5 days later, that case should be assigned to whatever 3 days before you came in. Done.
Yeah, thoroughly.
Yes, that is the way. If you do not follow your rules, then you're also not acceptably behaving. And then you have the last group with 2 hospitalizations greater than 30 days before admission. Again, not acceptable. And when you come, and then you have those 2 snuggled right up against admission. Again, does not make sense with the 0 to 19-year-old crowd. What you're left with that at least makes logical sense are just 63 out of the 338 total hospital admissions for the 0 to 19-year-olds between August 1st and September 15th.
Statewide.
Statewide. I can do this by county too if you wanted me to.
No.
Not right now. That would take too long. But so when they're talking about hospitalizations in our children, already the rate of hospitalization per case for our children is ridiculously low, like obscenely low, because we have this massive surge of cases. Interestingly enough, in the last 5 weeks or so, since schools started up again and everybody has to test and all those things, interestingly enough, that number just spiked to the stratosphere.
Yeah, and that's when we started with the library and
the library
too.
And everybody with a cold and all the little kids who are now getting RSV and hand, foot, and mouth and parainfluenza. Parents see that they're snotty, they're kids, and so they want to go test, and then the whole works. But very, very low hospitalization rate, even with their inflated numbers. We are looking at 338 total, but only 63 that have any prayer of making any sense whatsoever as being a hospital admission for COVID-19.
Yeah, I even feel like it's less for that time period, that it's less than that for COVID.
Well, no, that's being generous. That's what I'm
Okay.
saying. Logically, if you just follow it through logically and be very generous with your numbers, at a maximum, 63 makes sense as an admission for COVID. All right, I think we should kill it here. Carrie, sleep.
I guess I won't play devil's advocate, but I'm going to, because everybody is going to get to see Kathryn like get really upset, and she's going to make really ugly faces, and she's not going to be happy at all. But we're going to play devil's advocate.
All right, thank you, everyone. Or do you have any finishing words?
No, other than, you know, just for perspective on testing, we I know, you know, and I had said this to Kathryn, not that she checks her messages, but that's fine. It's fine. That in our county alone, we had greater than 53,000 tests that we went through. And less than 2 weeks. And in doing so, like, they have to go somewhere. I don't believe they were all with that all they were doing was just like hoarding them. I believe that people were using them because parents were extremely concerned. So, you know, with school and things, a lot of them just don't know what to do, what to believe anything. So I just think that a lot of it is that. But 53,000 tests gone.
By next now?
By next now, yep. So just as a perspective, you know, I don't know what's happening anyplace else. So, but okay, I think we are all done. And I know I have got to move around and do some things here. Like, you guys just didn't take the tour of my house. Sorry for that. You can definitely tell that we're live. And see, people are very disappointed that waited up to 11 o'clock for that devil's advocate. So we'll definitely have to do that again. Maybe Sunday with the attorney when he's present. It'll be great.
Okay, then.
All right.
All right.
I'm done.
Good night, everyone.
Bye.